The ins and outs of veterinary medicine was all recorded inside of Littleton West Animal Hospital located in Littleton, Colorado. I wanted to preface this by talking about COVID-19 and how much it has changed the inside of veterinary medicine. There's no longer much face-to-face interaction between staff and owners. Patients now have to be inside without their owners in most scenarios, and much more.
Usually we do everything in the rooms, but COVID has meant that we move everything back here. So we're not all spending all this time in a closed-up room. So that's kind of a little bit of the difference of all of this. So
the most common thing people know about when bringing your animal into the clinic is for a checkup. Veterinarians recommend you bring your animal in once every 6 months. A checkup involves a lot of things, from a specific concern that you or the doctor may have, an overall wellness check, getting their nails cut, and many more. There's a lot you can do to make sure your pet is happy and healthy.
Checking ears, checking eyes, checking his mouth, range of motion again, and sometimes it kind of looks like you're just petting them, but you can get the information that you need.
It is also very important to keep your pets' vaccines up to date. Animals tend to not like needles, so on top of veterinary staff keeping them comfortable, they also get creative with ways to keep them distracted.
It's kind of if we're thinking about food, we're not going to think about us getting a vaccine.
Yeah.
When we draw blood, we can either use the jugular vein or the front leg vein.
Mm-hmm.
This is super fast,
Yeah.
and they don't tend to freak out about it usually. Most dogs don't like their feet held, so they're kind of like, why are you holding my foot? And so sometimes that can create a little bit more anxiety for them. This always looks a little weird, but again, it usually is much faster than that other option. I see us using a combination of axillary and rectal temperatures. If we're not overly worried about it, this is less stressful for them, we'll do that. If we're worried about them, like they're sick or something, we'll do a rectal temperature. So to determine if a dog is overweight, you want to be able to feel the ribs. So a little bit like you can feel each of your knuckles if your hand's flat. You can't see them, but you can feel.
There are many different ways veterinary staff test for different things that an owner might be concerned about. One way is through urine samples, which is drawn directly from the bladder with a needle and examined. Another way is through blood samples that are put into a machine and mixed with chemicals that can find out if an animal has heartworms or other certain issues like that. And another is to look at samples in a microscope to look for parasites that can be very obviously seen and noticed. And that's about all there is to know about basic checkups inside of veterinary hospitals. But besides the regular old checkups, there are many surprises that walk into the door every day that the staff have to be prepared for. Take Apollo, a 9-month-old Doberman, as an example. He came in as an emergency towards the end of a checkup day after jumping a fence and getting into a fight with another dog. In the process, a part of his ear was ripped off and his stitches from his neuter a few weeks back got ripped. These kinds of situations can bring lots of stress into the work area, but the staff do what they can to help the animal in need. After a long work day, the team worked together to get Apollo stitched back up. They had the decision of helping him out or sending him to an emergency care unit. They decided to stay longer at work to help him out so he didn't have to wait hours to get fixed up. They had to put him under light anesthesia to get the job done, but both veterinarians worked on fixing the ripped ear and the torn stitches, and quickly got it done and were able to send him home in hopes he won't get into more trouble. Next is surgeries. Inside veterinary hospitals, they have assigned days for checkups and surgeries. On surgery day, the staff get started early in the morning and have a long day ahead of them. On this particular day, they had to do a dentistry, an eye removal surgery, and 2 spays. Each animal and situation is different, and they have to pertain to each in specific ways. And even though each case is different, the preoperative procedures for each animal and the surgeries themselves tend to stay the same.
Provides some pretty profound sedation. It's what we use for short-term processes by itself, but it can affect their heart rate. So we have these guys hooked up to monitors the whole time that they're under anesthesia.
To start preparing the animal for surgery, staff give the animal a calming type of medicine to mellow them out before beginning to put IVs and more medicine into them. It's best to work with a calm animal who won't move much while preparing them for surgery. The veterinary technician and veterinarian start by shaving the animals to get rid of any hair where there will be needles or surgery being done. This makes the area smooth and easy to work with, and it won't compromise the sanitized space. Next, the staff clean the shaved area and put in a catheter. This acts as a way to get drugs into the animal quickly, such as sedation.
Just our access into her vein to deliver drugs and emergency stuff if need be.
Sedation works very quickly once it enters the animal's body. There's a few ways you can tell if a pet is completely sedated, which is by testing their reflexes by tapping at the corner of their eyes, seeing if they have control over their tongue and mouth, and if they move at all. Once the animals are completely sedated, the veterinarian or vet tech then put in a breathing tube. This helps control the animal's breathing while being under anesthesia.
Lubed her eyes because she can't blink under anesthesia, so that was what I put in her eyeballs.
Then it's time to bring the animals into the surgery room. In order to get started, the veterinary technician hooks the animals up to monitors so they can monitor them throughout the surgery. They also tie the animals down and set up the tools necessary to begin.
They do use tie downs to keep their legs in one spot. You can see they kind of flop over a little bit.
One of the most important things before going into surgery is being sterile. In order to do so, the veterinarian has to completely clean their hands and use proper techniques when putting on gloves and gowns.
That's called sterile technique. And we're just trying to keep things as clean and prevent secondary infections the best that we can.
Every veterinarian has their own ways and ideas of doing things. If you were to ask different people in this profession, they would all most likely say they believe one thing works better than the other. But that's just how modern medicine is. We are all still learning new things every day, and that's why it's called practicing medicine.
Everybody does things differently as far as surgery goes. I am a big believer in I want to sleep at night. So this is how I was taught, and I just kind of stick to it. A lot of times, as you go through life, you get better at things, and you're like, you can take little shortcuts, right? But it's something that I won't ever kind of take shortcuts on this, just because, like I said, I like to sleep at night.
Yeah, I get that.
I've, done the things that I know are the right things to do, and not that it's not right. Again, it's always one of these things that everybody has their comfort level with things.
After surgery is over, the animals are taken back into their cages so they can rest and slowly wake up. The way every animal reacts to sedation is different, from how they wake up to how they feel once they're up.
Wake up completely calm, or they go completely overboard. There really is not a gray area for them.
Around a little bit, she might vocalize, but as she kind of becomes more aware of her surroundings, usually that will minimize.
All in all, veterinary medicine is quite a different experience and perspective from the inside. Understanding the ins and outs of a career like this is important in knowing what people do who save the lives of our pets and what they go through. Overall, this was veterinary medicine, the ins and outs.